must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, and welcome to the latest edition of the Health and Fitness Show. I am your host, Suliman Rafiq, and we are broadcasting live today on Thursday, the 16th of October, 2025. I hope and pray, inshallah, everyone is well and is in the best of health and iman. And inshallah, it's been an interesting week this week. We've seen a lot in the news about the topic we're going to be discussing. So listeners, today we're going to be talking particularly on the Health and Fitness Show about the impact of housing on your health, as well as the topic of asthma. So as always, if you have any questions at all, you can text or WhatsApp us on 07779 481822. That number again, 07779 481822. So just before we get into today's show, who out there has been watching Celebrity Traitors? Celebrity Traitors is the talk of the town at the moment. I'm loving it. I'm really enjoying Celebrity Traitors at the moment. So if anyone is out there watching Celebrity Traitors, as well as today's topic, it'd be great to hear your views on that. Who's going to win? Who's going to win? So we were having a discussion in the office today about that, and it divides opinion. So we'll see how it goes. But for anyone that hasn't seen it yet, highly recommended viewing. Highly recommended viewing indeed. But as I say, we're going to be discussing quite a serious health topic today. We like to talk about different health topics, and this is the first time, as far as I'm aware, we're particularly talking about the role of housing on a person's health, and also how that relates to asthma as well, particularly as we're coming in now to the colder season as well. It's particularly important, you know, for those of us who have children. We'll know everyone seems to be kind of coughing and spluttering around, and it is concerning sometimes, you know, to see children who are not looking too well. So we're going to be discussing that with Dr Tahir Mehmood, friend of the show and local GP as well. Delighted to say I've also got some expert guests here in the studio with me who I'll be asking to introduce themselves. So without further ado, Raymond.
Hi everyone, my name is Dr Raymond Li. I'm a public health doctor specialising, and I'm doing my work in Luton at the moment.
Fantastic. Thank you very much for giving up your evening to be with us on Inspire FM. Really do appreciate it. And brother Mohammed.
Assalamu alaikum everyone, my name is Mohammed.
Fantastic. And what's your connection to today's show? Because I've heard your name quite a bit this week.
Yes, you have indeed. So in short, I did get the government Eco4 scheme done to my house around September 2020. So July 2023 time. And the reason why I got it done was for my late father initially. But since then, we've just been having problems after problems after problems. So yeah.
Fantastic. Now it's been I've seen the articles online and you know, on TV as well. Really grateful for you to be here on Inspire FM to share your story and create awareness. I think a lot of people have heard of the scheme. Interesting to hear your story. So listeners, if you'd like to know more about that, stay with us and we'll be discussing that shortly as we go throughout today's show. But last but by no means least, over to you, Shabir.
Assalamu everyone. So I'm Shabir Hussain from Luton Borough Council. I'm the Domestic Energy Efficiency Manager.
Fantastic, thank you. And how long have you been doing that role?
I joined the council back in March 2021, so that's my background in energy efficiency. So it's since 2021.
Fantastic, that's great. So we still are just waiting for Dr. Tahir. He hasn't quite joined us yet. So what we'll do, we'll switch it around a little bit. If it's okay, Brother Mohammed, if I could just start with yourself then, and just if you could share a little bit more about some of the news for anyone who hasn't heard about this so far.
That's fine, Royce. So like I mentioned earlier, I did get the Eco4 scheme done to my house around July 2023. It was for my late father. The reason being is because during the colder months, it would be very, very difficult for him. He was severely asthmatic as well. And I felt that to help him out, let's get this done into the property. However, during the next month, we had a small leak, and I felt that it was really, really important to obviously get it sorted out as soon as possible. However, by trying to talk with the people involved, I was given broken promises after broken promise to the point where you've seen the article. It's that right now. And 2 years after, like 2 years on, we've been getting a lot more problems. So front gutters are leaking, back gutters are leaking. Underneath the we're getting leaks from underneath the underneath as well. Sorry. So yeah.
Yeah, absolutely. And then Shabir, in terms of like, what are the key issues in housing that you've come across in Luton?
So predominantly, key issues we hear from our residents are cold homes. So cold homes are due to lack of insulation, which can impact on people's health. Another common inquiries we get is broken heating systems. So a lot of people living in, again, cold homes with broken heating systems. Many people across the country are facing high energy bills, which has a massive impact on, being able to afford to keep your house warm. Some people choose not to even put the heating on because of the high energy bills. And this sort of leads on to damp and mould. So damp and mould is now becoming a predominant issue that we're becoming to here.
Excellent. So I'm just conscious because we're coming to the Azan break. That will be here in a couple of minutes, and we've got Dr Tahir Mehmood who's online. So he'll enter the studio after the Azan break. So please do stay with us, and Dr Mehmood will be joining us as soon as we have the Azan break. I mean, you mentioned there, Shabir, in terms of like the damp and the mold, and what kind of effect have you seen that having on residents?
So if we take Mohammed's case, his story, for example, his father already had respiratory health conditions, and when they had this insulation works done, because it was done poorly, the workmanship was very poor. What's happened is that there was water ingress. Water ingress then resulted into damp and mold appearing in the property. So when you have damp and mold, you have the pores in the air, which if you're breathing them in, it impacts on your lungs. So if you've already got respiratory issues, that's going to cause further issues, and it's going to exacerbate your conditions. And it's not just for someone with health conditions. Even someone without health conditions can start catching respiratory issues. So it's an uncomfortable situation to live in, and it's difficult.
And we've seen this the scheme that you referred to. I mean, there's been a huge amount of kind of promotion and stuff. A lot of people have been talking about it, Mohammed. I mean, have other people shared with you in terms of their experiences of this as well?
I mean, since being on the BBC, I haven't had any sort of people reach out to me regarding their experiences so far. And yeah, I mean, if they would require any sort of help, I'm happy to help. Make them, if needed, make them reach out to the right people. So yeah.
Sure. So I think it's important to for anyone who's finding themselves in the situation like Mohammed is, that not to kind of suffer in silence. That's as well.
That's it.
That's really important. Obviously, it's heartbreaking, your story, and it's fantastic that you're able to share that. But there's potentially a lot of people in your similar situation who are suffering in silence, and we'd invite them to come forward and connect and support each other with taking this forward. So listeners, we're 10 seconds away from the Azan break, so please do stay with us. It will be a very short break, and then inshallah we'll be picking up this topic with Dr Mehmood and Raymond straight after the break. Until then, assalamu alaikum.
Assalamu alaikum. In Luton and its surrounding areas, it is now time for Salatul Maghrib. This azan has been sponsored by Ideal Properties. Contact us on 01582 72 1110 or log on to www.idealpropertiesltd.co.uk.
Allahu Akbar, Allahu Akbar, Allahu Akbar, Allahu Akbar. أشهد أن لا إله إلا الله أشهد أن لا إله إلا الله أشهد أن محمد رسول الله أشهد أن محمد رسول الله حي على الصلاة حي على الصلاة حي على الفلاح حي على الفلاح الله أكبر الله أكبر لا إله إلا الله.
اللهم رب هذه الدعوة التامة والصلاة القائمة آت محمدا الوسيلة والفضيلة وابعثه مقاما محمودا الذي وعدته إنك لا تخلف الميعاد.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, and welcome back to the Health and Fitness Show. I am your host, Suliman Rafiq, and we are broadcasting live today on Thursday, the 16th of October, 2025. As always, you can text or WhatsApp us on 07779 481822. That number again, 07779 481822. This is the Health and Fitness Show, and today we are specifically talking about the impact of housing on a person's health, and in particular, asthma. Delighted to be joined by four fantastic guests who are giving up their time to share their insights on today's topic, and delighted also now, inshallah, we're joined by Dr. Mehmood. Assalamu alaikum, doctor. Can you hear us? Doesn't look like it at the moment, so we'll come back to Dr. Mehmood shortly. Can you hear us? Assalamu alaikum, doctor.
Walaikum Assalam, Suleiman. Thank you very much. Sorry about this.
No.
Poor connection. I haven't got a great Wi-Fi at my practice at the moment. Sorry about that.
No, not at all. We're really grateful. Thank you so much for your time this evening to talk to us about this really important topic. So, Doctor, we've got friends in the studio here who've been talking. Brother Mohammed, who had some work done on his house that has resulted in significant damage in terms of damp and mold as well. We've got Brother Shabir here from the housing department, as well as Raymond, who's a public health colleague as well. Dr. Mehmood, can you just tell listeners your relationship in particular to asthma?
I'm basically working for the NHS from Luton. My surgery's name is Biscuit Group Practice. Most people, they know it as a Blenheim Medical Centre. I've been working here for the last more than 20 years, and recently I took a leadership role as a strategy leader in asthma in BLMK, which is Bedford Luton Milton Keynes Integrated Board, ICB. I was also the lead for the children, young people, and families for the Luton area. So there was opportunity to work for the asthma lead as well. So that's why I took it. And my roles have ended just a couple of weeks ago because of the restructuring of ICB. So, and I think that was suitable for me, both roles, because they were linked together, as a children, young people and families lead in Luton, as well as asthma. On top of that, I was working as a general practitioner in Luton area, so that's why it was very interesting and a very challenging role, because if you remember that recently there were 2 children died in Luton with asthma, which has raised everyone's eyebrows. And there's a lot of things happening about the asthma's understanding in our local community, which unfortunately hasn't got a good health literacy rate in Luton area. And that's why asthma is very challenging in this area. In the whole BLMK, Luton has got worst statistics about the asthma in children, especially. In the UK, if you know that in UK almost about 4 people die every day due to asthma attacks, children and adults I'm talking about, and about 4.3 million adults in the UK have been diagnosed with asthma. That means 1 in every 12 person is affected with asthma, and about 1.1 million children in the UK have asthma, and this is about 1 in 11 children. And also, there were some statistics showing that 2/3 of asthma deaths in the UK were preventable. That means that the cause of asthma or the trigger could have been better managed. And this is an striking event that women are approximately 1.8 times more likely to die from asthma attacks than men. And I was working as a GP and coming across a lot of children and adults with asthma symptoms and poor understanding of asthma, attending accident emergency department, hospital admissions. And I thought that let's take this challenge as well. So alhamdulillah, we did very well in the last 2 years' time on asthma, especially in BLMK and Luton area.
Fantastic. And just from a parent's perspective, because you deal with a lot of patients face to face, what are some of the common kind of tips that you give parents whose children have been diagnosed with asthma? What things are particularly we're not maybe doing as well as we could in Luton? Dr. Mehmood? No, I think you might not be hearing me on my question. Okay, so we'll move on just in terms of some of the other things to be aware of. Sorry, Dr. Mahmood, can you hear me now?
Yes, I can hear you now, yes.
Yeah, thank you. So I was just asking there, in terms of when you're dealing with patients on a face-to-face basis, what are, for parents who have children with asthma, what are kind of some of the common things that you need to teach them and make them to be taking very seriously with asthma children?
Asthma itself is very, very serious and scary illness if you don't control it, manage very well. As I say, that every day 4 people die of asthma in the UK, and you can imagine that 1.1 million children are diagnosed with asthma. They're 1 in 11 children. So I emphasize on the compliance of the treatments, especially inhalers, and also avoidance the triggers of asthma, which could be a wide variety, like passive smoking. It could be stress, anxiety, inside the house, outside the house, all these sort of things. So my main topic is telling them the technique of using inhalers. If you don't use this inhaler, then it will be, as you wouldn't expect that you will get better with asthma, or your symptoms will be relieved. Because we've seen couple of patients, adults, even they did not know, and they were just spraying on the face and the neck area, the sprays, the inhalers. So, and the asthma was very, very bad. So understanding of asthma is very important, and I make sure that people coming to me, when they go out of my room, they have got better understanding of asthma and of other inhalers as well.
Absolutely. And I think last time you were with us, you were saying there's some good videos online, for example, that people can view if they're not sure in terms of how to take their inhalers as well. Because obviously, as you said, the techniques in which someone takes their inhalers is really important as well. So there's that's something. Is that right, Doctor?
Yeah. Actually, a lot of credit goes to Public Health Luton. They're working on a very, very hard, established asthma-friendly schools to provide more expertise and awareness for the asthma management in school time, the children, the parents. Also make a lot of videos of the experts, health professionals, to make more awareness and educate the masses in Luton about the asthma and inhalers. So a lot of work we've done recently with the public health, and are really, really grateful for them.
Fantastic, thank you. So maybe Raymond, if I could come to yourself just in relation to today's topic. So we're talking a lot about asthma and particular damp and mold. How does damp and mold in homes affect people's health?
Thanks, Suliman. I think, first and foremost, I really have to say my condolences to you, Mohammed. And it sounds like an absolute ordeal. And I think everyone listening agrees that they wish you the best. And I don't think anyone ever wants to be in that sort of position. I'm going to talk to you about asthma today. And, like Dr. Mehmood, my primary interest in asthma is children and young people. But as we see with your father, it's not just children and young people. While we see it a lot in children and young people, it is a long-term disease, and it's not just a flu kind of thing. It is a long-term condition that causes inflammation in your lungs and makes it hard to breathe. We do know that, generally speaking, mold in the house and damp and cold housing can be triggers for asthma. Yes, we can say, oh, I'd like to avoid it, ideally, but you can't always avoid it. We do know that, generally speaking, though, mild cases of mold and cold don't necessarily cause a huge problem. However, we do also know that it's quite rare, but we do see some strains of mold, because mold is a fungus. It can cause severe lung infections, and that people who have asthma are at higher risk of getting these infections, as well as doing poorly when they get those infections. So we suggest that if you or your family member has asthma, whether that be children or adults, make sure that you are engaged with your local GP. Make sure that you're attending your annual asthma review. Make sure that you've got a personalized asthma action plan. If you don't have these things, it'd be really good to speak to your GP and make sure that you've got this forward planning in case. Because as Dr. Mehmood says, 2/3 of asthma deaths are preventable. In fact, if you've got well-controlled asthma, you shouldn't ever really be ending up near a hospital at all. So 100% I agree that we should. 100% I agree that we should be trying to tackle this from the beginning, and we're doing a lot of work in the council in order to try improve this from all angles.
Fantastic. So you just mentioned there you've been doing some work at the council with asthma hospitalizations in children. Can you tell us a bit more about this?
Yeah, so recently we've been looking at some of our statistics at the local hospital, the Luton and Dunstable, and we've actually identified some striking, we'll call them, statistics about our admissions in hospital. We know that in Luton, we have about 1 in 18 children who have asthma. This has been quite a stable figure compared to England as a whole. Dr. Mehmood was saying earlier, it's about 1 in 11 children. So actually in Luton, we're doing quite well in terms of the number of children who have asthma. But the problem is that the number of children admitted to hospital in Luton is extremely high. I mean, out of the 20 wards in Luton, 15 of them have rates of hospital admission higher than the national average. At the highest in Beach Hill, it's 6.5 times higher than the national average. I think that suggests that, outside of the hospital, we've got plenty of work left to do. Within the statistics that we saw, actually, we know that the highest proportion of demographics of admissions is in the Asian community. In fact, one example would be 1/3 of all children admitted to hospital for asthma were Pakistani ethnicity. Compare that to 8% of them being white British. We, as a community, as a public health team, and just as people, I think it's all fair to say that we want the huge number of child hospitalizations to go down, but we also want to make sure that we get communities that we know are much more likely to face these kind of unfairnesses fairly addressed. So that's part of the work that we're doing here at the council.
Fantastic, thank you. So we're just quickly approaching the advert break, which was while we were distracting you. So thank you for that, Raymond. And listeners, what we will be doing in the second half of today's show is talking much more in terms of some of the practical things that families can do to keep their children well this winter. And in addition, we're going to be delving much more into the work Shabir's doing in regards to housing and the work that Mohammed's been involved with as well. So listeners, please do stay with us, and we'll be right back after this short commercial break.
This program will continue after the break. Continue listening to Inspire FM. Inspire FM.
Inspire 105.1 FM.
Assalamu alaikum. This is Yasmin from Bedford. Keep tuned to Inspire 105.1 FM.
For 30 years, we've been opening doors for small businesses and large, opening fully stocked fridges and same-day deliveries, opening birthdays and graduations and new homes and happy tears and you shouldn't haves, opening ambulances and life-saving support, opening roads that open up cities and countries and continents, opening up the world. See how the Mercedes-Benz Sprinter can open doors for your business at your local Mercedes-Benz dealer today.
Landlords, let us take away the hassle of letting your property. Our comprehensive services include tenant vetting, rent collection and service charges, maintenance and repairs. Ideal Properties has 2 branches and have been established over 20 years and have gained a wealth of knowledge and experience.
If you are thinking of selling or letting your property, then speak to a member of our knowledgeable team about a free, no-obligation market appraisal.
We can also offer guaranteed rental income.
Contact us on either Luton 721110 or 696050. Ideal Properties, service with a smile, whatever your needs.
The difference between a believer and one who does not believe is that the believer primarily turns to Allah. Before everything, we say Bismillah.
Universal Clutches on Cosgrove Way in Luton offer more than just clutch repairs. We also now cover MOTs, servicing, brakes, suspension, and vehicle recoveries. We've got you covered whether you drive a manual or semi-automatic car, van, or truck. We aim to provide a quick and reliable service, and Universal Clutches are an AA and RAC approved garage. For a reliable service you can trust, call 01582 876 300 or find Universal Clutches on Google, Instagram, and Facebook.
Biscott Pharmacy, your one-stop health and beauty pharmacy in Luton, stockist of over 8,000 health and beauty products. At Biscott Pharmacy, we offer a range of services, including health advice and repeat prescriptions for collection and delivery to your home. We also offer a Hajj and Umrah vaccination. Come in and see us and ask about our Stop Smoking service. We're open 7 days a week till late, including bank holidays. Biscott Pharmacy, 157A Biscott Road, Luton. Call 457709.
Can you imagine losing your parents and seeing your home destroyed? Thousands of children in Gaza have lost one or both of their parents. Agorsh UK invites you to sponsor an orphan in Gaza and provide them with life-changing care, protection, and hope. Let's help orphans to rebuild their lives. Donate your zakat and sadaqah for an orphan in Gaza today. £500 per year or £42 per month. Visit Agorsh UK.
अदब मुलाहिजा होशियार
माजी हाल मुस्तकबिल की बातों के सुराग इल्मी अदबी अफसाना शायरी और जिंदगी के राज हवा की लहरों से बन के आवाज ये है प्रोग्राम चराग पेश किया जा रहा है हर जुमा शाम 7 से 8।
From the studios of Inspire FM, the time is now 6:30.
Any health advice given, whether general, diet, physical, or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum, and welcome back to the Health and Fitness Show. I'm your host, Suliman Rafiq, and we are broadcasting live today on Thursday, the 16th of October, 2025. Thank you so much for staying with us. This is the Health and Fitness Show, and today we are specifically talking about the impact of housing on a person's health and also the topic of asthma. Delighted to be joined by our four fantastic guests, and we'll just be picking up on the topic that we were just discussing there in relation to the impact of the house on a person's health in particular. And I believe Dr. Mehmood is still with us online, and we'll just be asking him to rejoin us in a moment just to discuss the importance of vaccinations as well. But Raymond, sorry we had to cut you in there just to go to our advert break. But just in terms of, is there anything else parents and families can do to keep their kids healthy?
100%, Suliman. The thing is that, you know, as we alluded to earlier, asthma is a long-term condition, and it's set off by a lot of things. And as we go into winter, people are going to find if they've got asthma, it's going to get worse, you know, due to the cold, as well as winter infections. You can't really do much about the cold in this country, unfortunately. That's just how it is. But what
only
you could, if you could, I mean, you know, climate deniers might have to change their tune there. But one thing you can do something about are the winter infections. It's really important that if people are going to struggle with their asthma when they get a winter infection, that we try to limit the spread of these, especially vulnerable, you know, groups like children and young people, as well as older adults. I used to work as a doctor in Southampton, and one of the most common things that we saw in the respiratory unit there, especially amongst people with asthma, was flu. You know, children with flu, older adults with flu. All it takes is just one, you know, very common illness for most of us, but it's the straw that breaks the camel's back. You know, it sends them into a pretty ill state and makes them need to go to hospital for extra support. No one wants that. And the number one thing that we can do to prevent our kids, our families, our grandparents, our parents from being admitted is to get the flu vaccination. It's a safe, effective vaccine. It's available on the NHS for free for all primary and secondary school children, as well as over 65s. And it's, especially in Luton, I think it's important to highlight that, you know, we've got the nasal spray, which is one thing. But if you're worried about it having porcine products in it, the injection, which is equally as effective, also is available and doesn't have any pork products in it. It's a good excuse also to go visit the new Bury Park Health Hub. That's just a bit of self-promo there. We've got the new Bury Park Health Hub at the community centre, open 9 to 5, walk in so you can get your vaccinations there. But that's the number one thing I think that families and parents can do to make sure that their kids don't get admitted to hospital.
Fantastic. And Dr. Mehmood, are you still on the line with us?
Yes, I am. Yeah. Can you hear me?
Yes, we can. Thank you.
Just sorry about this.
That's okay.
Sorry about this. My internet has been very embarrassing today.
No
so
problem.
That's why I have to come out.
No problem at all.
Well, it was just emphasis what the Ray was saying, emphasis to the community on flu jabs and vaccination. It's a life-saving and it's free on NHS. And you are getting messages from the GP surgeries wherever you are registered for the eligible people to come into the surgery. And flu jabs. Flu jabs is also now available on the pharmacies and the Bury Park Health Hub.
Fantastic.
But many people, they think that the flu jab can cause problem. It will never cause problem. Only 2 people they cannot get this flu jab. People who are allergic to eggs and have got high temperature. Flu jab will save your life your family's lives, and also hospital admissions. My emphasis is that please go to the GP surgeries or pharmacy, local pharmacy, and get the flu jab and get protected.
Thank you so much, Doctor. And just for our Urdu listeners, maybe you could just capture that in a few minutes in Urdu, please.
या मैं सारे जो लोग सुनने वाले हैं पाकिस्तानी इंडियंस और जो लोग उर्दू हिंदी को समझते हैं उनसे यही मैं गुजारिश करना चाहता हूं कि ये विंटर सीज़न है, इसमें हम आप लोगों के लिए फ्लू जैब जो प्रोवाइड करते हैं फ्री NHS की तरफ से। आपको बेशुमार टेक्स्ट मैसेज आ रहे हैं, लेटर्स आ रहे हैं सर्जरीज की तरफ से कि फ्लू जैब आके लगवाएं। वो जो लोग एलिजिबल हैं उनको हम मैसेजेस कर रहे हैं, और वो जो लोग जिनको क्रॉनिक हार्ट कंडीशन है या कोई भी क्रॉनिक हेल्थ कंडीशन है उनको हम मैसेज आ रहे हैं, बच्चों को भी आ रहे हैं, बड़ों को भी आ रहे हैं। तो प्लीज़ इन मैसेजेस को, इन ख़तों को, इन लेटर्स को इग्नोर मत करें और वहाँ पे अपनी GP सर्जरी के साथ जाके फ्लू जैब लगवाएं। फ्लू जैब लगवाने से आपकी हेल्थ ठीक रहेगी, आपको निमोनिया का ख़तरा कम होगा और आपकी लाइफ बचेगी और हॉस्पिटल एडमिशन से बच जाएंगे आप। एंड ये पर्टिकुलरली विंटर सीजन में बहुत इंपॉर्टेंट होती है। और जो लोग या GP सर्जरी में नहीं आ सकते वो फार्मेसी में भी जा सकते हैं और बड़ी पाक हेल्थ हब में भी अटेंड कर सकते हैं। तो मेरी आप सब लोगों से यही मुद्दाना गुजारिश है कि प्लीज़ अपने जो आपको जो मैसेज आ रहे हैं उनके मुताबिक अपनी GP सर्जरी में जाएं और फ्लू जैब आज ही और विद इन फ्यू डेज लगवा लें, क्योंकि जितनी जल्दी आप लगवाएंगे उतनी जल्दी आपके लिए बेहतरी होगी इंशाल्लाह।
That's great. Thank you, Doctor. I really appreciate your time. I know you're extremely busy, but I'm really grateful for you coming on the show today. Thank you. Take care.
Thank you very much for having me. Thank you.
No, pleasure. Thank you. So, listeners, you've heard there from Dr. Mehmood around the importance of taking both asthma and the flu jabs, you know, really seriously. Obviously, a local GP who's been serving Luton for many, many years has given up his time to share those messages. If you do have any questions yourself, you can text or WhatsApp us on 07779 481822. That number again, 07779 481822. I do now want to pivot to focus more on the housing, because obviously this is something we've been hearing a lot about in the news this week, particularly. There's been government announcements, there's been news articles, etc. And, you know, we've all been seeing these promotions and adverts around different schemes that are available, not just in Luton, but across the country. So, Shabir, you're the Domestic Energy Efficiency Manager at Luton Council. You touched earlier on what some of the, you know, some of the issues are around housing and, you know, your experience as well. But particularly in regards to the grants that everyone's been hearing about, what support or grants are available for families living in poor housing conditions?
Okay, so currently there's 3 major grants. The first one is called ECO4, which stands for Energy Companies Obligation. Then you have what's called GBIS, which is Great British Insulation Scheme. These are government-funded programs. Recently was launched Warm Homes Local Grant Scheme, which an allocation is being given to local authorities, but it's managed externally. But all these schemes are run by government and administered by external bodies. Information is available on the council's website. So if you go to Luton Council, search for energy grants, you'll find a list of all the current grant schemes available.
Fantastic. On Tuesday, the National Audit Office published a report, Energy Efficiency Installations under the Energy Company Obligation, that's made the news this week particularly. Can you tell us a bit more about what the key findings are from the report?
There are a number of key findings, and I'll like to spend a couple of minutes on this, particularly because it's quite detailed. So what the report did was it looked at the ECO4 scheme and GBIS scheme, which is a national scheme, again, funded by managed by government, funded through energy companies. So residents can apply for these grant schemes to get insulation measures, you know, replacement boilers, and a few other measures applicable to their homes. Now, as councils, we have very limited input or say in these grant schemes. So we don't set the qualification criteria. We don't sort of tell government, okay, this is a property we need to do. It's done purely through installers that are working under these schemes. Now, like many councils, if you look at Luton and other councils across the country, we have a net zero target. Some targets are 2030. Luton's is for a town to become net zero by 2040. So we heavily rely on these grant schemes to help address cold homes, people living in fuel poverty, reduce energy bills, and deliver warm homes for those in need. And those people in need are on lower income, receiving benefits that are highly vulnerable to a cold home. Now, what the report focused on was two measures to do with under these grant scheme. One's called external wall insulation and one's called internal wall insulation. So what is external wall insulation? Okay, so if you take Bury Park, for example, if you look at the houses along there, we call them solid wall properties because of the way they're built. They're Victorian homes over 100 years old. And the problem with these properties, solid wall properties, are that the only way to insulate them is either externally or internally. Now, when you heat your home, you have a lot of heat losses through the walls. So you can lose up to 35% of your energy through the walls. So taking that into consideration, the only two options here to improve these homes is either doing the external wall insulation, a lot of people know as external cladding, or doing the internal wall insulation. Most people go for the external insulation because the internal insulation, it takes a bit of floor space, it's a bit more messier. So they opt for the external wall insulation. So what that does is it retains the heat, so you're not losing so much heat, and so your energy bills will come down. Now, if installed correctly, it works fantastic, and we have seen examples where it has worked really well under other grant programs. But under the ECO4 scheme, and this is what the National Audit Commission found, was that there was a high level of poor installations carried out under the ECO4 scheme. This is nationally. So since ECO4 was launched back in 2022 and it runs for 4 years, £4 billion funding has gone into this, which is coming through our energy bills. What the National Audit Commission found was that between 22 and 23,000 homes which have had external wall insulation carried out, 98% have issues which will require remediation works, which is phenomenal.
Yeah, 98%.
So 98% of the works of these houses require remediation. 6% of this have major issues, so which are health and safety issues, so which is blocking ventilation, blocking flue pipes, electrical issues. So 6% of that 98 is critical, very which have major issues. They also found only 1% have minor issues. So, but over time, the insulation will become to degrade and, there will be issues. And only 1% may actually pass the accreditation, so the standard which they need to be installed at. Another major thing they found in the report, 165 million has been claimed fraudulently under this grant scheme. Again, we're paying for this through our energy bills. It's a green levy. So, as bill payers, this is shocking to us because, we want to see homes improved. We want to see it done correctly. But if this is, what the audit report has found, it's absolutely shocking. Now, the key stats for Luton is, so we've been working with a Trustmark, which is a government quango, and they gave us a report. So just in Luton, so between 2021 and end of 2024, 4,200 homes have had external wall insulation installed. Now, if we take that 6% figure, which the government's saying, so 6% of these are poorly, which have major defects, major health and safety risks, that puts 252 homes at risk, but we don't know who they are, where they are. So as Luton Council, we've been very, very proactive in trying to help our residents and also feedback to the government of these issues that we've come across over the past few years. So, many residents have rang the council and said, look, we've had this insulation, we've got all these issues. Can you help us? Because the companies are not helping us and no one's listening to us. And Mohammed will talk more about his experience on this. So we've been working with Trustmark, and we're trying to find a way where we can help and find remediation for the homes impacted. Now, one of the things that you touched upon, and which Mohammed, I did when I first spoke to Mohammed, was there's many residents in Luton that are suffering in silence. Please don't suffer in silence. Come and talk to someone is important, because if something's wrong, you've got, your property is being damaged. Okay, and it needs to be fixed. There's a property in Berry Park which was covered last year, and that's, the remediation cost is currently standing over 230,000 to fix that property, which is phenomenal, and it shouldn't got to that stage. So external wall insulation, I mean, it's a good measure, but it needs to be installed correctly. And that's the problem, is that there's a lot of rogue traders, a lot of cowboys that have been operating in Luton that haven't installed it. As Mohammed will explain, that you contact the company that involved, they just don't respond, false promises.
Yeah.
You go to the accreditation bodies, you go to Trustmark, you just sent round in circles. It's a common story we hear from all our residents.
Yeah.
But we're being very fortunate as myself, that I've spoken to a lot of these organisations. I've been asked to give evidence at the Common Select Committee earlier this year to highlight the issues. So we, as a council, we are working with public health teams and community teams to try and get the message out there. Please come and talk to us.
Yeah. So Mohammed, just to bring you in then, so obviously you found yourself in this situation. Was it difficult to get help or support from external bodies or organisations?
100%, absolutely. So I'd say this during June, July time this year, I was continuously emailing them every single day, to the point where I just gave up. I'm receiving the same sort of email by different bodies, going around in circles, literally no help or not being heard whatsoever. So I decided to obviously look back at the Common Select committee which Shabir was in, and I found him in there. I'm thinking, if I'm not getting any support from the external bodies, let me try and get some sort of help from the council and Shabir. And thankfully I did, because without his support, without his help, maybe you wouldn't be here right now. Since the start of this sort of incident, we are gradually progressing, and it's looking like there's a light at the end of the tunnel. So yeah.
Fantastic. It's great to hear that. But if I may ask, in terms of, obviously this has been going on for quite a period of time, how has this impacted your own health and well-being?
It's been really, really stressful, honestly speaking. You mentally draining. Like, you wake up every single day just thinking, when is this going to end? Like, physically speaking, when you wake up, when I wake up, I'm continuously breathing really, really heavily, to the point where, I'm sure you've read the article. I feel it in my neck, in my lungs. Like, it's really, really hard. Like, the air quality around the house is very, very poor. It's been really, really tough. So yeah.
And I did see the article, but from your perspective, how did it feel when your story was shared, obviously by the BBC?
Yeah, I suppose first things first, I'd like to say a massive thank you to Zoe Conway for listening to my story. She took out her own time to come down to my property, sit me down, and obviously see the damage firsthand. In terms of obviously how I felt, I suppose you could say relief and gratitude, because now I'm finally being heard, and at the same time sad and angry, because it shouldn't have gotten to this point where I have to go through the BBC to be heard. Or yeah. On top of that, my father's home it's been destroyed. Like 2 years. The fact that we've got damp, mold, cracked plasterboards, everything just falling apart. So yeah, I mean, it's just been really, really hard, honestly speaking with you.
Yeah, and I think, you know, we're extremely grateful to you for shining a light on this really important topic, because naturally, for the reasons you've just described, it is difficult to talk about. So very grateful for you to do that. And just finally, obviously, there may be people who are listening to this who are going through similar struggles. You know, what would you like to say to them?
To anyone going through the same issue I'm going through, just don't give up, honestly speaking with you. Keep pushing for help. I was grateful to have help from my uncle, because he had connections with Zach, and Zach had connections with an independent surveyor, which I'm grateful for. Reach out to family members, friends, they might have connections within the community that could help out. And most importantly, document everything. It's very, very crucial. Photos, emails, dates on when you've contacted a company. If you'd like, you could speak to Shabir as well from the Luton Council. I'm more than happy to help out as well.
Fantastic. And then Shabir, I'm conscious we've only got about 4 minutes left, but I did just want to kind of finish with yourself, just in terms of, you know, this is an area of work that you've been involved with for a long time. I mean, has there been any kind of success stories that have stood out to you at all?
What, in relation to?
In relation to try and get progress in this space at all? So you mentioned like the select committee there.
I mean, success stories is that we're, you know, being able to go to the Common Select Committee and give evidence, being heard, putting a voice, you know, we're a voice for many of our residents and many people across the country. Success story that, you know, we are working with companies like Trustmark who are coming to Luton and carrying out pilot projects. So, you know, we've done many pilot projects with them. Success that we've been able to help some of our residents and getting, you know, well, that have contacted the council and to resolve the issues. So, you know, there are many success stories, but there are a few. I mean, you know, there's many more that are struggling, and we want to reach out and try and help as many people as we can.
Yeah, and listeners, you know, if you're finding yourself, if this is resonating with you, please do get in touch on 07779 481822. That number again, 07779 481822. Just a couple of final questions, Shabir, just in terms of how do you work with health professionals to identify at-risk households?
So under the ECO4 scheme, it's divided in two sections. So you have where residents qualify through what's called the DWP benefit route. Then there's a second option, which is through low income and health conditions. So we work with PCNs, primary care networks, we work with GPs. So if they have any patients that have health conditions living in a cold home, they can refer them to the council, and then we put them in touch with installers, or there's a list of installers on our website they can contact, who will take them through the process to get their homes much warmer.
Great. And what advice would you give to someone worried about their home affecting their health?
Speak to a healthcare professional. Don't suffer in silence. And there's a lot of help and advice available out there. There's some fantastic work going on through various bodies and through Luton Council. So reach out and ask for the help, and, you know, don't suffer in silence. We're here to help you.
Fantastic. And then just finally, I understand the council has launched a survey around energy efficiency. Can you give us a bit more details?
Yeah. So it's just the first survey we've carried out in Luton. So we want to, because when all these installation programs happen, these government grant programs happens, we don't get the data fed back to us, so we don't know how many homes have been improved. So it'd be great if people can fill out this survey, which is available on the council website. So because it will help us to identify homes that are suffering that we can, get grants for. It will help us towards our net zero target. And any future grant funding programs, we can identify areas which require further help. So for every survey completed, we will contribute, we will donate £1 towards a Luton food bank, and I think 10 people can win vouchers up to £25.
Fantastic. So there's more information about the survey on the council's website.
On the council website, on social media, on Facebook.
Fantastic. That's great. So apologies, guys. We've completely run out of time. So nothing left to say other than a huge thank you for giving up your time and shining a light on this really important topic. Listeners, as always, we'd love to hear from you around future topics you'd like us to cover on the Health and Fitness Show. So if you have any health-related topics you'd like us to talk about, please do let us know. And you can text or WhatsApp us on 0779 481822. That number again, 0779 481822. And until the next time, assalamu alaikum wa rahmatullahi wa barakatuh.
My name is Iram. Please tune in to Inspire FM 105.